I would say my patients describe me as a good listener. I think the longer one listens to one's patients, the more likely we are to come to the right answers and the right solutions in terms of treatment. It's very easy to jump to conclusions when someone has a symptom or a complaint, but the longer we listen, often that's where the solutions arise. My wife and I were originally attracted to the Pacific Northwest because of the climate and the beauty of our surroundings. Specifically, we were looking for a small town to raise our family. We also enjoy having close proximity to the ocean and to mountains. A lot of our outdoor activities are how we spend our free time, skiing in the winter and tennis and biking in the summer, and we have all those opportunities here in the Mid-Valley. I think I would like to accomplish over time actually having spare time. It may take some time to achieve, still in the relatively early part of my career, but we enjoy every minute we can spending as a family. So initially I had some interest in being a scientist, being a neuroscientist in particular. I had interest in doing research, and as I got into that field a bit more and did some work with professors in college, I realized that there wasn't a lot of direct applicability to what I was doing to patient care and improvement in people's lives. A lot of value in doing research, certainly not discounting that, but I enjoyed being a more personal part of helping people day to day. And that's where my interest in science merged into an interest in medicine and being able to work directly with patients. My approach to patient care involves first listening to the patient to find out what the issues are and not trying to jump to conclusions. After we have an understanding of what we want to improve with respect to their sleep disorder, then we work as a team. There is no treatment approach that's going to be successful unless both the patient and the physician are in agreement and want to move forward. There are a variety of sleep disorders that we specialize in taking care of, including sleep-related breathing disorders, most common of which is obstructive sleep apnea. We also take care of individuals with excessive sleepiness, with conditions like narcolepsy, for example. We take care of individuals with restless leg syndrome, with movement disorders while they're sleeping. So a variety of conditions that fall under sleep medicine. What makes my job personally rewarding is the ability to help people in a relatively rapid fashion. Sleep disorders are very treatable. Most of the treatments we have do not involve medications. They're generally physical or behavioral type of treatments, and people get better from these conditions fairly quickly. That's a very satisfying part of what I do because we can see improvements sometimes overnight. One of the greatest aspects of working at the Corvallis Clinic is having colleagues and peers who are exceptional physicians. We have opportunities to pick up the phone and talk to a colleague in a field of medicine that isn't ours and get an immediate, intelligent answer to the question that we have. That's what I respect most about working at the Corvallis Clinic.